Medical research institutes are often viewed as a simple machine. You put research funding in and get medical advances out. The more funding that goes in, the more advances come out. But the reality is much more complicated. Medical research institutes are, in fact, sophisticated ecosystems. There's the research and a supporting foundation that enables this research to happen. This foundation is made up of critical elements such as a skilled workforce, specialized lab equipment, state-of-the-art facilities, biobanks, research commercialization, and cybersecurity infrastructure to keep scientific and patient data safe. These and much more make up the full picture of what it costs to successfully undertake and deliver medical research. It's this foundation that allows our institutes to deliver world-leading breakthroughs in cancer, diabetes, infectious diseases, mental health, cardiovascular disease, neurological disorders, and numerous other areas that benefit Victorians. In fact, Victorian researchers are more successful at securing medical research grants to undertake life-saving research than all other Australian states and territories. But while research grants cover this bit, they don't cover this. Currently, if a Victorian Medical Research Institute receives a $1 million grant, it needs to find and funnel an extra $480,000 into its foundation to simply undertake this research and keep running. Our overburdened institutes have been plugging this gap with philanthropy, fundraising, commercial income, research investment, and some government support. But the ongoing success of our institutes means that these costs keep growing. The future of our medical research institutes depends on additional funding to keep their foundations strong and their research running. Our institutes have benefited from decades of strong and sustained investment from successive Victorian governments. Working with the Victorian and federal governments, we can ensure our medical research institutes are armed with robust and sustainable foundations. Their cutting-edge breakthroughs are what position Victoria as a global destination for medical research and keep Victorians healthy.
I was diagnosed with lymphoma in December 2020, and even on the toughest chemo, it was still growing. Without having CAR T cell therapy, I wouldn't be alive today.
CAR T-cell therapy is a type of immunotherapy that we're using to treat patients with cancer. It's a very personalised type of medicine, as opposed to drugs that work on attacking cancer cells more generally. And it's a one-off treatment that can be curative.
Within 30 days of receiving my cells back, my scan showed a complete response. I burst into tears, didn't really hear anything else after that. And my husband's jaw literally dropped. This big black mass that was there suddenly wasn't there. It was my miracle.
We've treated over 150 patients now, and we see complete remissions in around 60% of those patients.
If I wasn't able to have CAR T in the time that I was able to have it, I'm certain I wouldn't be here today. So many people can be saved from these new treatments.
We can do more and we can do it faster to be able to get our research to a point where we make a difference to patients. My research relies on critical costs that are not often covered by grants, and some of these things include some of the specialised equipment that we need to scale up our products, the infrastructure required for supporting our research, biobanking of patient samples, and particularly that translational aspect of our work where we're hoping to commercialise, develop Australian IP and bring money back into the research community.
I'm coming up to 3 years in remission. September will be 3 years. It was our miracle and our chance at being a family again.